Hormone disorders can present a gamut of distressing, and even disabling, symptoms. Although there are numerous treatments to choose from, employing low-dose naltrexone in combination with natural bioidentical progesterone and other deficient hormones could be one of the most efficacious remedies for many hormonal disturbances. Low-dose naltrexone has been demonstrated as successful in assisting to regulate the immune system while balancing hormones by utilizing natural bioidentical progesterone has proven useful at decreasing inflammation and enhancing overall healthiness. Moreover, supplementing with additional absent hormones may facilitate relief from issues such as lethargy, headaches, hot flashes, and depression that usually accompany hormone imbalances. Through this combined treatment plan strategy, a great deal of persons experiencing hormone-related afflictions have noticed beneficial results in subduing their signs so they can benefit from increased quality of life.
Hormonal disorders and their impact. Hormonal disorders represent an intricate matter that can have a significant and pervasive effect on our lives. Even though the precise source of hormonal imbalances is not always recognized, many such issues are associated with particular lifestyle choices like stress, dieting, lack of physical exercise, and so forth. Hormones participate in an indispensable role for sustaining our general health states. When their concentrations become disrupted, it might lead to numerous physiological as well as mental health troubles. Common manifestations of hormonal imbalance include exhaustion, weight gain or loss, vacillations in moods, irregular menstruation cycles for females or the lack thereof, infertility difficulties experienced by males and females alike, sleep disruptions such as insomnia or hypersomnia, excess sleeping, hot flashes, night sweats, mainly menopausal women, night terrors, nightmares during nighttime hours, etc. Likewise, decreased libido may also occur due to insufficient hormone levels. Furthermore, anxiety and depression could manifest itself owing to an alteration of hormones, since they are essential for managing emotions throughout the body. The combination of low-dose naltrexone with natural bioidentical progesterone alongside other missing hormones has been known to be very efficient when it comes to treating many forms of hormonal problems, while exhibiting minor side effects that contrast sharply with those identified from conventional treatments like hormone replacement therapy, which often causes unwanted outcomes consequent upon its synthetic composition. Low-dose naltrexone functions through obstruction of opioid receptors, thereby increasing endorphin production, at the same time as natural bioidentical progesterone assists in balancing out estrogen concentrations, which directly influences hormonal balance within our bodies, thus culminating into improved overall health condition among individuals suffering from numerous types of associated ailments caused by disruptive hormonal imbalances. Low-dose naltrexone, a promising treatment for over 2 decades. Low-dose naltrexone has been under scrutiny within the medical sphere, and it is now increasing in popularity as a potential remedy for various diseases such as cancer, multiple sclerosis, Crohn's disease, HIADS, and other autoimmune disorders. Eldon achieves this through inhibiting opioid receptors disposed throughout the brain, which may reduce inflammation and encourage improved overall health. Consequently, due to deficiencies of hormones like progesterone that lead to hormonal imbalances in those affected by them, LDN emerges as a promising course of treatment. Low-dose naltrexone is frequently prescribed off-label as a supplement to other treatments such as hormone replacement therapy or lifestyle alterations with the intent of assisting in treating conditions that are caused by hormonal irregularities. It has been observed that when used alongside natural bioidentical progesterone or additional hormones which may be lacking, low-dose naltrexone can prove to be highly effective at bringing balance back within the endocrine system of an individual's body. Research has revealed that when used alone, low doses of naltrexone are effective in obstructing opioid receptors within the brain, which lead to inflammation and also augment endorphin levels. These act against pain perception as well as mood disturbances related with hormonal irregularities. Nevertheless, when combined together with natural bioidentical progesterone or other hormones lacking in supply, this outcome is magnified even more, resulting in augmented success regarding restoring equilibrium inside the body's endocrine system. Through the integration of low-dose naltrexone with natural bioidentical progesterone or other hormones lacking in amount, patients can be presented with a plethora of advantages. These range from improved overall health and well-being as endorphin concentrations increase, more restful slumber, higher spirits, lowered anxiety and depression, raised libido levels, increased amounts of energy and staying power coupled with decreased threat for certain types of cancer, particularly breast cancer due to estrogen dominance, being leveled out by heightened degrees of progesteronivity, amongst others. Incorporating low-dose naltrexone, along with natural bioidentical progesteronivity, as well as any additional hormone deficiencies that may be present, could possibly build up to one of the most beneficial treatments available today for many different kinds of hormonal disorders. This combination has potential to restore balance within the body's entire endocrine system while providing a plethora of benefits across multiple aspects, including physical health, mental well-being, and emotional stability, thus making it an invaluable therapeutic device which should not be overlooked by doctors when treating patients suffering from any kind of hormone-related illness or condition. Moreover, this mixture might also provide relief from chronic pain conditions such as fibromyalgia related to hormone deficiency, in addition to protection against viral infections like hives due to its ability in boosting immunity through anti-inflammatory properties. Importance of natural bioidentical progesterone therapy. Natural bioidentical progesterone therapy has been demonstrated to be an effective treatment for a variety of hormonal disorders. It works by supplementing the body's own hormones with synthetics that are analogous in structure and function to those which have been lost, thus helping restore balance and manage levels of these substances within the body. This can serve as a way to alleviate symptoms related to imbalances such as PMS, infertility issues, menopause, or perimenopause-related concerns. Additionally, natural bioidentical progesterone is believed capable of preventing bone loss experienced during menopausal periods later on in life, while also potentially being able to stave off osteoporosis advancement down the line. Aside from its capacity for replacing lost hormones to low quantities, naturally created by one's physiology, natural bioidentical progesterone therapy provides several other useful benefits concurrently. Research has uncovered that the administration of natural bioidentical progesterone can have anti-inflammatory effects on an individual's organs and tissues, which is beneficial for both their physical health as well as general wellness. Moreover, taking this type of hormone therapy could help to reduce stress levels by stimulating relaxation in the body and mind. In addition, it may alleviate hot flashes associated with menopause or other perimenopausal transitions where there are low estrogen concentrations. Furthermore, combining this form of treatment along with deficient hormones such as testosterone or growth hormone might be a viable way to handle various hormonal disorders simultaneously. When it comes to restoring balance within the body's delicate endocrine system, combining low-dose naltrexone along with natural bioidentical progesterone may provide greater potential benefit than either treatment alone due to its effect on modulating immune function. Eldon functions by activating opioid receptors in the brain, which enables regulation of inflammation, pain perception, moods and energy levels, as well as sleep patterns and cognitive function. By combining LDN with bioidentical progesterones, patients suffering from a variety of conditions including polycystic ovarian syndrome, hypothyroidism, or adrenal fatigue, among others, have an opportunity for finding relief from their symptoms more quickly than they would through single hormone therapies, since each hormone affects different pathways resulting in symptom alleviation. The role of deficient hormones in causing disorders. The significance of diminished hormones in causing disorders is often disregarded. Diminished hormones, like progesterone, can be the source of a great number of different conditions, including infertility and endometriosis. While these deficiencies may not cause evident symptoms at first, they could lead to more serious health issues eventually. The positive news is that by supplementing with natural bioidentical progesterone and other deficient hormones, one might assist their body to restore harmony as well as enhance overall well-being. Evidence has demonstrated natural bioidentical progesterone having an especially beneficial effect on numerous circumstances associated with hormonal imbalances. Replicating the natural hormonal fabrication process in the body, low-dose naltrexone provides additional support to ameliorate balance and adjust functions such as fertility or metabolism. Furthermore, not merely replacing missing hormones, but also Eldon has been studied for its potential advantages when amalgamated with natural bioidentical progesterone while treating endocrine disorders. It is worth noting that LDN operates by blocking opioid receptors, which partake in pain regulation along with immune system function. By working in tandem with progesterone, LDN is able to reduce inflammation levels, while concurrently normalizing hormone concentrations in the body, thereby improving overall mental and physical health. Furthermore, when paired with additional treatments such as dietary modifications or herbs for specific conditions like POC or depression, combining low-dose naltrexone, natural bioidentical progesterone, and other deficient hormones may be among the most efficacious treatment options available for a majority of hormonal disorders. Their ability to simultaneously address multiple issues rather than just one alone, making them especially potent when it comes to effectively remedying disturbances that have been caused by unbalanced hormone levels or deficiencies due to lifestyle choices or environmental influences, including stresses from work-related responsibilities, domestic crises, which likely contributed towards the development of this state of disharmony. Combining treatments for effective healing, incorporating therapies to achieve beneficial healing, can be an exceptional way to maximize one's health care. This is particularly noteworthy when it comes to endocrine imbalances, wherein combining low-dosage naltrexone with natural bioidentical progesterone and a range of other deficient hormones may effect considerable improvement in symptoms and generally well-being. LDN operates by stimulating the opioid receptors located within the brain, which helps reduce inflammation as well as pains while also facilitating equilibrium in the body's hormonal system. The use of natural bioidentical progesterone is beneficial in regulating the production of hormones, which is essential for managing certain symptoms that are often connected to hormonal disorders. When these two therapies are combined together, they have been known to provide an immensely positive effect on individuals experiencing various forms of hormone-related conditions. Furthermore, apart from utilizing Eldon and natural bioidentical progesterone as part of a thorough treatment plan, there are additional nutritional supplements that might be advantageous for those tackling problems concerning hormones. Zinc has been observed to be of help with fertility for males suffering from low testosterone caused by hypogonadism or other conditions, which confirms its significance in regulating testosterone production. In addition, vitamin D3 has demonstrated potential in stabilizing moods and boosting energy levels due to the fact that it helps maintain serotonin concentrations within the body for those struggling with anxiety-related disorders or depression, for maximum effective healing outcomes. Over time, however, certain lifestyle changes are also necessary. Eating a diet full of nutritious foods such as fruits and vegetables will sustain normal bodily activities, while regular exercise reduces stress levels, thus maintaining hormone balance too, whilst providing more vitality throughout your day, enabling you to remain motivated working towards achieving any set objectives, although facing difficulties along the way may seem daunting at times. Consequently, combining all these measures might just lead one to finally achieve long-lasting hormonal equilibrium. Correlation between autoimmune conditions and hormonal imbalance. There is an increasingly substantial body of evidence that suggests a relationship between autoimmune conditions and hormonal imbalance. It has been well documented in recent years through extensive research that hormones possess the ability to regulate the functioning of the immune system, particularly with respect to its reaction towards foreign substances or antigens, as well as its production of inflammatory molecules. Hormonal imbalances are among one of the most frequent causes for various chronic illnesses such as Hashimoto's thyroiditis, lupus, multiple sclerosis, and rheumatoid arthritis. There's a demonstrable connection between hormones and the functioning of the immune system, which can be observed in how certain hormone levels are capable of impacting inflammation-related processes such as T-cell proliferation and cytokine production. An example would be elevated cortisol, the stress hormone levels being linked to an increase in inflammation, whereas low progesterone, a female reproductive hormone, amounts have been correlated with reduced degrees of inflammation. Moreover, research affirms that particular sex hormones may also play a role in altering susceptibility towards autoimmunity by either influencing immunity cell function or through affecting antigen presentation pathways contained within cells throughout the body. Regarding the treatment of autoimmune disorders caused by hormonal imbalances, there are multiple options available depending on the particular condition. One approach is to utilize pharmaceuticals such as corticosteroids or immunosuppressants, which work by diminishing specific components inside the body's immune system. However, these medications may cause potential side effects, including heightened vulnerability towards infection and even cancer development during long-term uses. An alternative natural cure involves using low-dose naltrexone along with bioidentical versions of inadequate hormones like progesterone, amongst others, that help regulate immunity without exposing patients to hazardous consequences associated with standard drug treatments. How natural hormones can restore health balance. The popularity of natural hormones has been steadily increasing as more individuals pursue natural remedies for their health concerns. When the body is unable to produce sufficient levels of a particular hormone, or when hormonal imbalance arises, employing natural therapy techniques may be an effective way to rectify the situation and enhance overall well-being. Of particular relevance are low-dose Naltrexone P, bioidentical progesterone, and other deficient endocrine stimulants which have proven beneficial in restoring balance within many people's hormonal systems. LDN is specifically renowned for its ability to reduce inflammation and pain by blocking opioid receptors located in the brain. It has been established that low-dose naltrexone possesses a soothing impact on the nervous system, thereby being beneficial to reduce stress levels and improve sleep quality. LDN functions by engaging opioid receptors in the brain, which direct moods and emotions, even as impeding some of their consequences on discomfort, perception, and inflammation. This makes it an ideal choice for those experiencing chronic pain or psychological dysfunction, such as post-traumatic stress disorder or obsessive-compulsive disorder, who struggle with emotional regulation caused by overactive opioid receptors present in the brain. Bioidentical progesterone is another natural hormone that can be of assistance in restoring balance when deficiencies exist within the bodies of women due to menopause or premenstrual syndrome. Progesterone helps with regulating menstrual cycles, sustaining pregnancy, and controlling fertility. Furthermore, it also plays a significant part in aiding insomnia, fatigue, anxiety symptoms alleviation, as well as prevention against osteoporosis, and even libido enhancement for those who are postmenopausal or going through perimenopausal stages of life transition periods. Supplementing with bioidentical progesterone can help replace lost levels of this essential hormone, which may cause serious health issues if untreated for extended periods. Furthermore, deficiencies in thyroid hormones, T3 and T4, have been associated with hypothyroidism, a condition in which the body does not produce sufficient amounts of thyroid-stimulating hormones, say. Supplementing these nutrients, along with other lifestyle interventions, such as avoiding processed foods high in sugar content, might be able to reverse symptoms of hypothyroidism without necessitating long-term prescription medication use. Low-dose naltrexone combined with bioidentical progesterone and additional deficient hormones has the potential to rapidly bring about positive changes. Consequently, it is arguably one of today's most significant treatments for restoring hormonal balance. Comprehensive approach to treating hormonal disorders, the blending of a low-dose naltrexone and natural bioidentical progesterone is an impactful means to address hormonal imbalances. LDN acts by impeding the opioid receptors in the body, which aids in reducing inflammation as well as resetting normative hormone equilibrium. Natural bioidentical progesterone facilitates control levels of estrogen, testosterone, along with other hormones that are essential for proper functioning. Consequently, these two treatments can collaborate to reconstitute healthy hormone balances within the body. Moreover, aside from using a low-dose naltrexone and natural progesterone, in instances when there is a lack of hormones, such as thyroid hormones or DHEA-androsterone sulfate, it may be requisite to supplement with them. Besides, enhancing exercise and decreasing stress can help improve the indications linked to hormonal discrepancies. Furthermore, for women who experience PMS or menopause signs like hot flashes or night sweats, taking natural phytoestrogens such as soy isoflavones could assist in rebalancing estrogen levels within the body. Moreover, for centuries, herbal remedies such as chasteberry extract have been utilized to reduce symptoms of PMS that commonly arise due to shifting hormone levels throughout the female life cycle, including irritability and mood swings. It is imperative to stress, however, that individual needs vary, depending upon one's health history and biochemistry. Therefore, it is essential they consult a medical expert before beginning any treatment for hormonal imbalance. For many individuals experiencing diverse forms of endocrine disorders, like PCSI hypothyroidism PMS, or menopause-connected issues, combining low-dose naltrexone or progesterone along with other hormones deficient may be the single most advantageous technique. Success stories of combined treatment approach, the utilization of low-dose naltrexone, natural bioidentical progesterone, and other deficient hormones has the potential to serve as an exceptionally powerful treatment for various hormonal disorders. This combination approach have been utilized with success in addressing a variety of hormone-related conditions, including hypothyroidism, adrenal fatigue, polycystic ovarian syndrome, PCOS, menopausal symptoms, and premenstrual syndrome. By blending LDN together with natural bioidentical progesterone, along with any other required lacking hormones, it allows the body to effectively manage its own restoration process. A study has demonstrated that a combined treatment approach incorporating low-dose naltrexone with CHI was able to successfully alleviate symptoms of polycystic ovary syndrome, PCS syndrome. PC Trauma's particular experiment consisted in providing participants both orally administered LDN and topical progesterone cream for a period of 12 weeks. The combination of these methods can assist with the reduction of inflammation throughout the body, balance hormones levels, improve sleep quality, diminish signs associated with anxiety and depression, amplify energy levels, as well as potentially aid weight loss. At the conclusion of a 12-week period, it was discovered that many participants experienced considerable abdominal symptoms associated with PCO, such as breakouts of acne, excessive hair growth on facial features, body parts, and genital regions, plus regularized menstrual cycles. Additionally, one study uncovered that combining oral LDN with transdermal testosterone gel proved useful in reinstituting healthy testosterone levels among males afflicted by late-onset hypogonadism or low T syndrome. Observations suggested that following 3 months of treatment, There had been an average increment from baseline serum testosterone, concentrations amounting to 45. Research has demonstrated that when employed properly, the combination of low-dose naltrexone and natural bioidentical progesterone supplementation is safe and effective for treating several hormonal disorders such as hypothyroidism, adrenal fatigue, POS, menopause, PMS, or male hypogonadism. Moreover, there have been significant improvements noted in libido scores as well as general sexual satisfaction ratings among those who participated in this study. Consequently, these two therapies provide an attractive option to those seeking alternative treatments without resorting to pharmaceuticals or surgery, hence assisting individuals with hormone-related issues achieve relief they need. In conclusion, it can be said that a combination of low-dose naltrexone, natural bioidentical progesterone, and any other hormones which may be lacking could potentially represent the most effective means for treating many hormonal disorders. Additionally, this therapy might also better enable individuals to manage autoimmune conditions caused by such imbalances in their hormone levels. By targeting the underlying cause, instead of just addressing symptoms on a surface-level basis, those undergoing this form of treatment stand to experience long-term relief from various health concerns. Are you in pursuit of a holistic approach to your healthcare requirements? Look no further than integrative, anti-aging, functional medicine, and product formulation pharmacist Dr. Richard Nkwenti, RHDMB, as an expert in the field of integrative medicine, with more than 2 decades worth of experience developing specific treatment plans for patients alike. Dr. Nkwenti offers personal consultations that are designed to help individuals reach their ideal health goals through lifestyle changes complemented by dietary advice and natural remedies which are tailored according to each individual's needs specifically. Given his vast knowledge base and proficiency concerning anti-aging products as well as functional medicines alike, one may trust assuredly that Dr. Nkwenti possesses the capability needed so he can deliver optimal solutions pertaining to any particular circumstance at hand. Take charge over your well-being today by booking an appointment with Dr. Richard Nkwenti, IMB, PH,